Hi, my name is Kara Browning, and I'll be talking with you today about the Affordable Care Act and colorectal cancer screenings. So, according to the CDC, colorectal cancer is the second leading cause of cancer-related death in the United States. And because of this, the United States Preventive Task Force reviewed the effectiveness of colorectal cancer screenings and determined that colorectal cancer screening should be done for every adult starting at age 50 and should be continued until they reach the age of 75. This recommendation actually received an A rating. But despite this recommendation, many adults still fail to have their colorectal cancer screenings. So the Affordable Care Act tried to address this, and they required that both private insurers and Medicare completely cover the cost for a colorectal cancer screening. It mandated that screening tests, including colonoscopies, flexible sigmoidoscopies, CT colonography is also known as a virtual colonoscopy, guaiac-based fecal occult blood test, the fecal immunochemical test, the multi-targeted stool DNA test, and the methylated SEPT9 DNA test all be covered at no cost. So if a patient decides to undergo a colonoscopy or a flexible sigmoidoscopy for their colorectal cancer screening, the test is considered a screening until if a polyp or some sort of abnormal tissue growth is seen and needs to be removed during the procedure, then it becomes a diagnostic procedure. And Medicare then requires that the patient pay 20% of their coinsurance requirement for the test. For private insurance, so the same ruling doesn't apply. The polyp removal or the tissue biopsy still remains an integral part of the colonoscopy for screening purposes, and the patient isn't responsible for cost sharing in the private insurance market. So many people, including myself, believe that this is kind of a double standard and it doesn't quite seem right. Why does Medicare get to charge for it, but private insurance companies don't? And federal legislation was actually brought up by it about this problem, but unfortunately, the legislation is likely not to pass. If a patient decides to undergo a less invasive colorectal screening test, such as the virtual colonoscopy or the fecal immunochemical test, the cost is still completely covered as directed by the Affordable Care Act. But if that test is positive, the patient will need to undergo a colonoscopy. At this point in time, that colonoscopy again becomes diagnostic, and the patient is expected to pay their deductible or their copay. So, in theory, the Affordable Care Act was supposed to help remove cost barriers that were associated with colorectal cancer screening. And for some, this is true, but for many, the Affordable Care Act is only partially helpful. My second job is actually at an outpatient endoscopy center, and we can do as many as 45 colonoscopies in a day. And being the interop nurse for that, most of the time, I can tell you for the 45 procedures that we do, maybe 3 people don't get any sort of biopsy or polyp removal. So more often than not, a biopsy is taken and then the patient becomes responsible for covering their copay or deductible. So to me, further improvement still needs to be made around this legislation and the requirement for the cost for it. For example, I feel that if a fecal immunochemical test comes back positive, that the colonoscopy that's required after that should still be considered screening and not become diagnostic because the colonoscopy needs to be done. And if the cost is still there for the colonoscopy, that just gives the patient further reason not to follow up and have it when they genuinely need it. So, there's extensive research showing that colorectal cancer screenings provide cost savings in the long run, and we should honestly do what's necessary to remove the cost barriers associated, especially at the screening stages. Thanks.